Oxazepam is a medication that is used to treat anxiety and acute alcohol withdrawal. It belongs to a class of drugs called benzodiazepines, which work in the brain and nerves to produce a calming and anti-seizure effect. It does this by enhancing the effects of a natural substance in the body called GABA. People typically take oxazepam 3 or 4 times a day, with or without food. It is important to take it at the same times each day. If you are taking it for anxiety, the typical dose is 10 to 15 milligrams, 3 or 4 times a day. If you are taking it for alcohol withdrawal, the dose will be determined by your doctor. Remember to follow your doctor's instructions carefully. Make sure to read the medication guide provided by your pharmacist before starting oxazepam and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor. The dosage is based on your medical condition, age, and response to therapy. If you have been using this medication for a long time, it may not work as well. Talk with your doctor if this medication stops working well. While oxazepam helps many people, it may sometimes cause addiction. This risk may be higher if you have a substance use disorder, such as overuse of or addiction to drugs/alcohol. Take this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. Be sure to inform your doctor if your condition lasts or gets worse. Some common side effects of oxazepam include drowsiness, dizziness, blurred vision, or headache. These effects may improve as your body adjusts to the medication. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many individuals who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as changes in mood, difficulty speaking, clumsiness, trouble walking, changes in sex drive, tremors, difficulty urinating, sleep disturbances, fainting, unusual fatigue, signs of liver disease, or signs of infection. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of all possible side effects. If you experience any other effects not mentioned here, consult your doctor or pharmacist for further guidance. In the US, contact your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, contact your doctor for medical advice about side effects. You may also report side effects to Health Canada at 1-866-234-2345. Oxazepam is a medication that has the risk of being misused and causing addiction. It is important to take this medication exactly as prescribed by your doctor to lower the risk of serious side effects. It is also important to avoid alcohol and other drugs that can cause drowsiness or breathing problems while taking oxazepam, as this can lead to very serious side effects, including death. If you experience slow or shallow breathing, severe drowsiness, or difficulty waking up, it is important to seek medical help right away. Suddenly stopping this medication can also cause serious withdrawal symptoms, especially if you have been using it for a long time or in high doses. To prevent withdrawal, your doctor may slowly lower your dose. It's important to communicate with your doctor or pharmacist if you experience any withdrawal symptoms, such as headaches, trouble sleeping, restlessness, confusion, depression, nausea, or seizures, as these symptoms may last for weeks to months. Always follow your doctor's instructions and ask about any concerns you may have regarding the medication. If you are allergic to oxazepam or other benzodiazepines, or if you have any other allergies, talk to your doctor or pharmacist before taking this medication. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Before using oxazepam, it's important to inform your doctor or pharmacist about your medical history, especially if you have liver disease, kidney disease, lung/breathing problems, or a history of drug or alcohol abuse. Oxazepam may cause dizziness, drowsiness, or blurred vision. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do it safely. Avoid alcoholic beverages while taking this medication, and talk to your doctor if you are using marijuana. Older adults may be more sensitive to the side effects of oxazepam, especially drowsiness, which can increase the risk of falling. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks and benefits of using oxazepam. This medication may harm an unborn baby, and newborn babies of mothers who use oxazepam late in pregnancy may experience symptoms such as slow/shallow breathing, non-stop crying, shaking, or trouble feeding. Oxazepam also passes into breast milk and may have unwanted effects on a nursing infant, so consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with oxazepam include clozapine, digoxin, kava, orlistat, and sodium oxybate. Additionally, the risk of serious side effects, such as slow or shallow breathing and severe drowsiness or dizziness, may be increased if this medication is taken with other products that may also cause drowsiness or breathing problems. Be sure to inform your doctor or pharmacist if you are taking other products such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, such as allergy or cough and cold products, because they may contain ingredients that cause drowsiness. If you have any questions, ask your pharmacist about using those products safely. Lastly, if you smoke or have recently stopped smoking, it's important to tell your doctor because smoking can decrease the effectiveness of oxazepam, and your dose may need to be adjusted. If you or someone you know has taken too much oxazepam and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can reach out to your provincial poison control center. Symptoms of an oxazepam overdose may include extreme drowsiness, decreased reflexes, slow breathing, fainting, or loss of consciousness. It's crucial to get help right away in these situations. It's important not to share oxazepam with others, as it is against the law. If you are taking this medication for a long time, your doctor may want to do some lab or medical tests to monitor your liver function and blood count. Make sure to keep all your medical and lab appointments and consult your doctor for more information. If you forget to take a dose of oxazepam, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take double the dose to make up for the missed one. Remember, always follow your doctor's instructions for the best results. When it comes to storing oxazepam, it's important to keep it at room temperature, away from light and moisture. Make sure to store it in a place that's out of reach of children and pets, and definitely not in the bathroom. When it comes to getting rid of any leftover oxazepam, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, you should properly dispose of it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.